Welcome back. You are watching Get Healthy with Dr. Cooper. And the topic of our show today is colon cancer. What does that mean? How can you prevent it? And I have an expert on my show today, Dr. Zamir. Welcome. Dr. Zamir is a very good friend. Welcome, Doc.
Thank you. Thanks for having me here.
It's a pleasure, as always, to have you on the show.
Thank you.
Tell us a little bit about yourself. Where are you from, Doctor?
I'm from Pakistan, and I had my training in New York. I did my residency and my GI fellowship there. And since then, I've been here in the Valley for past 20 years. Currently, I'm with Renaissance Gastroenterology, and I see all kind of GI cases. My expertise mainly difficult colon polyp removal.
Difficult ones, right?
Yes, the flat ones and the difficult ones. Yes, this is my area of interest. And also my area of interest is in pancreatic biliary issues. That is my area of interest. Yes.
Doctor, you have been a good doctor. Most of my patients love you very, very well.
Thank you.
As a matter of fact, you've also seen my husband. That's how much I have faith in you.
Thank you. Thanks for your confidence on me.
So, Doctor, we're discussing colon cancer.
Yeah.
And I think it's the second most common cancer here in the United States. Tell us a little bit why we should encourage your patients to get screened.
Well, very important thing to know about colon cancer before I talk about the symptoms and everything. One very important point that I want to relate to my audience today is that colon cancer in the early stages do not give any symptoms. So this is a key point that I want to stress to my audience, that colon cancer in the early stages is symptom-free, meaning patients do not have any symptoms whatsoever. They're completely healthy and they're still harboring colon cancer in their colon.
So that is why patients should be screened.
That is why patients should be screened, because screening means that you're looking for colon cancer without any symptoms. If they have symptoms, then this is the diagnostic procedure. This is not a screening anymore. That's why we encourage screening at the age of 50 in order to catch colon cancer in the early stages so that we can cure the disease. And I'm using the word cure here, not treatment only. It means that we can cure the disease if we catch colon cancer in the early stages. However, as I said earlier, many patients tell me that, oh, I don't have any symptoms, so why I should be screened? My answer is, again, colon cancer in the early stages is completely symptom-free. Another common argument about the patient is that they tell me or mention to me that I don't have any family history of colon cancer. Yes, you don't have family history of colon cancer, which is good. However, 80 to 85% of the colon cancers, they do occur in patients who have no family history of colon cancer. So not having colon cancer does not mean that you cannot develop colon cancer. As I said earlier, 85% of the patients, they do not have family history of colon cancer.
I'm very happy you used the word cure.
Yes.
A lot of people tend to believe once you're diagnosed with cancer, that is it. But catching the cancer early is important.
Yes.
So I want to let our audience know that if your doctor suggests screening, do not hesitate, because we have various modalities for screening the patient.
Yes. Yeah. We do have various modalities to screen for colon cancer. With a couple of differences. However, the major difference between, I would separate it for educational purposes, screening methods into one, colonoscopy, and the rest of the other methods. So colonoscopy, you're achieving two things. Number one is the early detection of colon cancer and the prevention of colon cancer.
And the treatment.
And the treatment, because if you catch it early, you can treat it. However, with all other modalities, you can detect colon cancer, but you cannot prevent it.
That's right.
Now the question is that how we prevent colon cancer by colonoscopy. The answer is that when you're doing the colonoscopy, you are looking for small polyps. Polyps are like little growth from the inner wall of the colon, which ultimately can lead to cancer. So if I remove this polyp during my colonoscopy, I am preventing colon cancer because cancer developed from those polyps. That's why this screening method is different from all other methods, because it can not only detect colon cancer in the early stages so that we can cure the disease, plus it prevents colon cancer. This advantage, no other screening test has it. That's why this is the gold standard for screening.
That's right.
Colonoscopy.
Yes, so I love that. But I also want to tell my audience that you can also prevent colon cancer with lifestyle. If you stay tuned, I will discuss ways for you to eat and exercise and manage stress to prevent colon cancer. So we're having other modalities. So colonoscopy is the gold standard. If it's negative, it's done once every 10 years.
Yes.
We begin at age 50.
Yes.
But if the patient doesn't want colonoscopy, then there are different modalities.
Yes, there are different modalities available. Actually, tier 1 or the first obviously is colonoscopy. Second thing is every year FIT, fecal immunochemical testing. This can be done as an alternate for colonoscopy. Again, this has good sensitivity for the colon cancer detection, but as again I want to emphasize the point again that the FIT or the fecal immunochemical testing will not prevent colon cancer.
I agree. You know what, doctor? I'm going to take a break right here. Then we're going to return and discuss all the modalities. So let's take a break. We'll be right back after these messages.